Assalamualaikum and welcome back to Nasi Lemak Kopi O. Today we have invited two students from Jenis Insan to present about the research.
Assalamualaikum warahmatullahi wabarakatuh. My name is Adib Fahmy and here today with me is Ahmad Firdaus bin Muhammad Iwan. Today we are going to talk about our research project on miscarriage and its solution. So Firdaus, what exactly is a miscarriage?
Miscarriage is the loss of pregnancy during the first 23 weeks. The majority are caused by anything the mother has done. Most first trimester miscarriage happen because the fetus doesn't develop normally. So, why does this happen?
There are different factors that can cause a miscarriage. The majority of miscarriages can't be prevented. Some women can be helped to keep their pregnancy with medication under the care of a specialist if she has suffered from more than 3 miscarriages.
The early loss of pregnancy is common. According to the American College of Obstetricians and Gynecologists (ACOG), it occurs in 10% of non-pregnancy.
The Mayo Clinic also estimates that about 50% of miscarriages are due to chromosomal and genetic issues. The risk of miscarriage definitely increases with age. For example, according to the Mayo Clinic, the risk of miscarriage is 20% at age 35. It increased to 40% at age 40 and rises further to 80% at age 45. So the idea that we are proposing through our research is to strengthen the endometrium of the female body. So Firdaus, what is the endometrium?
The endometrium is the innermost lining layer of the uterus and function to prevent adhesion between the opposite wall of the myometrium, thereby maintaining the patency of the uterine cavity.
So how does the endometrium thicken naturally?
The endometrium changes throughout the menstrual cycle in response to hormone. During the first part of the cycle, the hormone estrogen is made by ovaries. Estrogen causes the lining to grow and thicken to prevent the uterus from pregnancy. So, Adib, what is the solution of a miscarriage and how does this work?
The solution that we are thinking about uses vitamin B12, vitamin E, and two or a few more natural hormones produced by the body. The reason why we are using vitamin B12 and vitamin E is because the concentration of vitamin B12 in a woman's blood circulation has been proven to improve the endometrium. There are also some studies that suggest vitamin E supplementation may assist in thickening your uterine lining. But if the endometrium is too thick, there is a big chance that endometrial hyperplasia will occur. As such, the medicine needs to have a stabilizer or even a reducing agent to prevent endometrial hyperplasia. For example, treatments for the excessive endometrial thickness include progestin, a female hormone that prevents ovulation, and hysterectomy. The medicine or drug we are about to make should be in a soluble capsule like the ones for antibiotics, but with 2 compartments. Before taking this medicine, the patient must perform an ultrasound test to first analyze the thickness of the endometrium. The first compartment will contain the thickening or increasing agent. The color should be bright red, symbolizing increasage or addition. The agent will have a cobalt plus 3 ion as the foundation and bonded with the main components of both vitamin B12 and vitamin E, which is the alpha tocopherol, beta tocopherol, gamma tocopherol, and delta tocopherols, and the corresponding 4 tocotrienols. The 4 tocopherols have a saturated fetal side chain, while tocotrienols have an unsaturated isoprenyl side chain containing the 3 double bonds at the 3rd, 7th, and 11th carbon atom. the agent should have estradiol basic elements, which are 2 hydroxyl group, one at the 3rd carbon position and the other at the 17th beta tocopherol position, as well as 3 double bonds in the A first ring in the cyclic structure. So the agent will contain progestin, the only natural hormone that is known as of now to decrease the thickness of the endometrium. Thank you for watching. I'm Adib Fahmy.
I am Ahmad Firdaus. Don't forget to like, share.
Don't forget to like, share, subscribe to our YouTube and Instagram channel. Links will be down in the description. Bye bye.
Thank you Adib Fahmy and Ahmad Firdaus. The show has come to the end. Thank you for watching.